Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday. And today we're talking about what to do if you're diagnosed with hypothyroidism. I've had a couple discovery calls in the last couple weeks where somebody said, hey, I got diagnosed as with hypothyroidism. What do I need to do? So let me kind of go over some things. So the first thing that you need to keep into consideration is if you were diagnosed with hypothyroidism, what tests were run to make that diagnosis. If it was just which is typically done, a TSH and maybe a free T4, then my suggestion would be before you jump to getting on a prescription drug, run a more comprehensive panel, okay? So one of the things you want to do is you want to take a look at, if you run a more comprehensive panel, it's going to be more than a TSH and free T4. So you'll have TSH, you'll have total T4, total T3, reverse T3, free T4, and there'll be thyroid antibodies on there, okay? Now leave the thyroid antibodies off for the moment, but if you got diagnosed with hypothyroidism, then we want to take a look at the rest of the numbers to make a decision. Are you a person who truly needs thyroid hormone replacement? Are you the person who's got a gland that can't make thyroid hormone anymore? So if your T4, your T3, your reverse T3, free T4, if these are all lab low and your free T3 to free T4 ratio is greater than 0.34 when you're using picomoles per liter, your gland is not producing enough thyroid hormone. And so all of the totals are going to be low. There's not enough T4 being made by the thyroid gland. Therefore, there's not going to be enough T3. Therefore, there's not going to be high levels of reverse T3. So in this situation, everything is low. There's a good chance that your thyroid gland is not making enough thyroid hormone. And therefore, what we want to do is determine what's the right next step. Well, the next step I would suggest is maybe run an iodine panel. Let's find out, do you have a true iodine deficiency? And if you have an iodine deficiency, then the problem's not going to be fixed with more thyroid hormone replacement. But giving you just T4 or T3 doesn't fix the issue. So why not run an iodine panel? So if you run an iodine panel, and different people have different opinions on how to do this, so you probably want to work with a functional practitioner, but you can do iodine testing in blood, you can do urine. I prefer to do both. So if your iodine is deficient on testing, then one, you're probably going to need iodine, at least in the short run. And the second thing we need to figure out is, why is your iodine low? So you got to start identifying what's causing you to have an iodine deficiency. If you run an iodine panel and your iodine panel is normal, then you probably don't have an iodine deficiency. And the second most common cause of hypothyroidism, or low thyroid gland production, is an immune-driven disorder. So in this situation, you might need thyroid hormone replacement. The second thing you want to do is start addressing your fitness factors, the things that Dr. Kelly and I talk about in the book: physical fitness, emotional fitness, environmental fitness, physical fitness, sleep fitness, respiratory fitness. So we want you to work on these foundational factors that for anybody would improve any health condition. So start breaking those down. What are you weak in and what can you build up? And then number 3, you want to work to ID the cause of what might be driving an immune-driven disorder. Now, you may fix a lot of those things by increasing your level of health in these things, in the fitness factors we talked about in the thyroid debacle. But you also may not be able to find everything. Maybe there's hidden infections. Maybe there's dysbiosis in the bowel. Maybe there's intestinal permeability issues. Maybe there's environmental toxicity that you're not aware of. Maybe you're not aware that you're under a lot of emotional stress and burden because it's your everyday normal. So these are things that need to be considered. So if you get your thyroid panel back, TSH is above 6.0, and I'm talking about TSH above 6.0 in both of these models. But in this model, if your TSH is above 6.0 and your total T4 and free T4 are within a normal lab range, then we're going to consider, this is going to probably be considered subclinical hypothyroidism. And this is where it gets tricky. You may have signs and symptoms in both of these situations. And somebody in allopathic medicine may or may not prescribe medication until that TSH is over 10 if your total and free T4 are within the normal range. Somebody in an integrative or functional medicine model who prescribes might say, well, if you're symptomatic and your TSH is outside the optimal range of 1 to 2, we're going to put you on thyroid medication because we want to optimize your TSH and we want to make you feel better. And it sounds good on the surface, but getting that hit of thyroid hormone may improve some symptoms, but it may set the stage for more problems down the line, unfortunately. So if TSH is greater than 6.0, total T4 and free T4 are within a normal range, and total T3 and free T3 are low normal, or what somebody might call functionally low, or lab low, you probably still don't need thyroid medication because you have enough T4 in the bloodstream. It means the thyroid gland's making plenty. There's enough available in the bloodstream, but it's not converting into T3. Now, the number one cause of that is some type of chronic low-grade inflammatory cell stress process going on. There are some people have genetics or genetic polymorphisms that reduce their conversion of T4 to T3, but it's about 20% in the most significantly compromised. So if these are lab low, functionally or functionally low, you have enough thyroid hormone. The reason TSH is elevated because your body's not doing a great job converting T4 to T3. Now the argument is that broken physiology, your body forgot how to do it, or is it adaptive physiology? If your reverse T3 is lab normal, and if it's high normal, or what we call functionally elevated, or lab high, then for sure there's some immune inflammatory process probably going on, and that's reducing the conversion of T4 to T3, favoring the deactivation of T4 to reverse T3, and that lower circulating total T3 and free T3 is resulting in that elevated reverse T3. It may also be that reverse T3 may also be elevated because if there's reduced T3 in the bloodstream, then the liver is not going to be able to process that reverse T3 out of the system quickly, and so that reverse T3 can build up from that perspective as well. And you've probably heard me say on a lot of these Thyroid Thursday episodes, I never run a thyroid panel by itself. I always run it with at least one tissue marker of thyroid status, and the one I run most commonly with is lipids because it really helps see the picture of what's going on with thyroid hormone at the tissue level. If your free T3 to free T4 ratio is less than 0.31, this means there's an underconversion. And again, this does not mean we need to take T3. If T3 is low, if free T3 is low, if the free T3 to free T4 ratio is low, this is not an indication that we need to give somebody T3. This is an indication that there's an immune inflammatory process going on and we need to deal with that. Now, there are people in the functional medicine space that would say, of course we're going to give T3 because we want to raise the T3 levels to make our patient feel better. Don't they deserve to feel better? I agree. If that's all you're worried about is optimizing their T3 in the bloodstream, great. They may feel better temporarily, but again, it's a slippery slope. The body's adaptively decreasing the conversion of T4 to T3. So giving them a T3, the thyroid hormone they're trying not to convert to T4-2, isn't necessarily going to make them better in the long run. Yes, in the short run, it may support some systems. Yes, it may make their symptoms a little bit better, but what's going to happen? TSH is going to drop. When TSH drops, there's decreased signaling to the thyroid gland to make T4, and now T4 levels in circulation drop. So now the person's going to quickly not feel so good because the thyroid gland is losing its contribution to the circulating level of thyroid hormone. So if this is your scenario, TSH is greater than 6.0, but with a normal total T4 and free T4, and a low T3 and free T3, and a normal to elevated reverse T3, with a low free T3 to free T4 ratio, this is not a person, in my opinion, that needs thyroid hormone replacement. We shouldn't be giving it to them. What we need to do is address their fitness factors, And 3, we need to work to ID what's creating the excessive cell stress response. This is not a case where I would necessarily think there's an iodine deficiency, because in true iodine deficiency, the body's not making as much T4. They're converting T4 to T3 more rapidly, okay? Hopefully this helps. I'll put more of these on Thyroid Thursdays. If you have any questions, put them below wherever you watch the video. All right, take care.